definite value of ICP from transcranial Doppler. The other limitation of transcranial Doppler is its operator dependent and results vary in traumatic brain injury to hydrocephalus and stroke. Other non-invasive method to measure intracranial pressure is optic nerve sheath diameter. Normal optic nerve sheath diameter is less than or equal to 3 mm. When it is more than 5 mm, we consider that the intracranial pressure is raised. It's again a quick, efficient surrogate marker of intracranial hypertension. It does not give us exact value of intracranial pressure. The limitations to optic nerve sheath diameter measurements are presence of any tumor, inflammation, sarcoidosis, or Graves' disease. Especially if the patient is optic nerve is affected or there is lesion in the orbit, then it is impossible to measure the optic nerve sheath diameter. The other non-invasive method is to measure tympanic membrane displacement. Tympanic membrane displacement is measured in response to sound stimulation. It causes contraction of stapedius muscle and movement of the stapes. Pressure changes resulting in the movement of stapes and displacement of tympanic membrane gives us a rough idea whether the ICP is raised or not. Again, the limitation is